Everybody wants to get pregnant naturally and avoid the treatments. Yes, I am Dr. Sneha, fertility consultant and gynecologist. In this video, I will discuss a few commonly asked questions when you want to conceive naturally. The first and foremost is, when should I have sex? Well, you may be a couple who's having sex every day or every alternate day. Then go ahead, no problem. However, if you want to hit the right date, that would be the day previous to ovulation and the day of ovulation. There is a video which speaks about how to track your ovulation. So once you know when you're ovulating, the best time is on the day or the day before. Also, we define something called the fertile period, which is the 5 days prior to ovulation leading to the day of ovulation. Why we say 5 days? That is because the sperms are active in the genital tract for about 3 to 5 days. So if you have sex during this time, you have a very good chance of conception. So this is when you must be thinking of having sex. Well, you can track your ovulation by several ways. One could be the calendar method, where you follow the calendar method when you have regular cycles, and if you have 28-day cycle, 28 minus 14 is 14th day you are ovulating. However, if your cycles are not regular, this may become difficult. Sometimes if you have a 30-day cycle, we consider that the second half of the cycle after ovulation is fixed. So if you have a 30-day cycle, it is 30 minus 14, so 16th day is somewhere when you are ovulating. Also, you can track your ovulation by doing scans or OPKs, which are the ovulation predictor kits, which detects the LH in your urine and tells you the date of when you may be ovulating. And also there are other methods such as the basal body temperature method, where you monitor your temperature, where there is an increase in the temperature after you ovulate and the progesterone is produced, or the cervical mucus method, where there is a change in the cervical mucus, thinning of the mucus around ovulation. So these are the ways how you can track ovulation, and this will help you try. And the next question which commonly is asked is, which are the lubricants that I use? Can I even use lubricants? Yes, there is one lubricant which is easily available in all the houses, that is coconut oil. Plain coconut oil is a very good lubricant and it is not toxic to the sperms. So this can be used as a fertility friendly lubricant. The next is, what sex position should I actually follow which will help me get pregnant? Any position is fine as long as the sperms are deposited inside the vagina. Also, the male orgasm is very much important so that the sperms are released, and any position which helps with this will help you get pregnant. Female orgasm though is also a necessity otherwise, but to get pregnant it is not compulsory. Next, few women have this misconception that keeping their legs high up or not peeing immediately after sex may also help them get pregnant. However, this is a myth. There is no scientific evidence to show that all these will help you get pregnant. So it is not a necessity to do this. So in spite of being a fertility specialist, I would love all of them to get pregnant naturally. Yes, I do get happy when I see the second line on urine pregnancy test and when it has happened naturally. So it is possible to get pregnant naturally by following a few simple tips and avoiding a few misconceptions.